Hi, my name is Rihanna Donald. My student number is T007263888. And today I'm going to be demonstrating patient prep and draping. I unfortunately, just due to some personal circumstances as well as just some of the issues that we're facing here in the clinic today, I am going to have to do my patient prep in our dental suite, which obviously is not a sterile suite. I'm going to pretend that this is the OR just for the stuffy presentation, but of course if this was a real surgery, this would have to happen in the OR in a sterile environment. So I am just going to move forward with the just working with what I have here. So I've got a pack here. This has not been autoclaved. This is just a pack I've been practicing with, but of course in a real situation I would use a sterile pack. So I'm just gonna get everything open and prepped for when our patient comes in. The first thing I'm gonna do is just let you know that I've washed my hands. I'm wearing clean scrubs. I've got my mask on and my cap, and then I've got some clean shoes on. I'm going to go ahead and open the first layer of the pack with my hands, and then I will move forward to opening it sterilely with my forceps for the second layer. After that, I'm going to go ahead and drop the towel clamps onto the pack so that it is sterile, and then we'll take you out and we'll start the portion of the patient prep. So I'm going to go ahead and do that here, and I might just have to move my, oh actually, you know what, I'll use my seat for that portion. So again, we'll pretend that these are Mayo stands, and I'm gonna go ahead and just start opening up the first pack. Hopefully you can see everything there. So that's been opened. I'm going to go ahead and get my forceps. So I can grab my forceps, and I will go ahead and open that second pack. Okay, so I've got my 4 ground sheets or drapes. We don't normally use the cloth drapes, but I'm using them for this presentation. Then I've also got my laparotomy sheet. So that is underneath there. What I'm gonna do now is go ahead and put the towel clamps beside it so that I can keep those sterile. And then we will go out and start the patient prep. So I'm going to peel the pack open sterilely without touching, and go ahead and drop those on without touching anything. I do have different size towel clamps just for this presentation, but again, in all of our packs we have got full sets of towel clamps of the appropriate size. So I'm going to take you over and we'll do our patient prep now. Okay, so we have got our patient on the table here. The first thing I'm going to do, well, our patient is pre-medded. I am going to go ahead and just give them their microchips. So first thing I will do is grab my gun, my microchip things, the chip, the information, and then the reader as well. I'm gonna just make sure that the microchip is reading to the same number. 522854, 522854, last digits, so this is matching. I would then go ahead and load the gun. I would go tent the skin, insert with my bevel up, fully press the trigger there, and then hold and pull out so that the needle doesn't stay in the skin. And then check, make sure it was placed, bidding, it's working, perfect. So, the next thing we're gonna do then, if I had my assistant with me, who's just sitting over here, we would flip the patient over and I'm going to start my prep. So I will grab my clipper blades and I'm going to confirm with the doctor about landmarking. We'll pretend Kelsey's the doctor. Kelsey, is this Flower the Cocker Spaniel? Yes. Is she here for a spay? Yes. So I am going to go ahead and check with the doctor, make sure that my landmarking is correct. For a spay, I want to find the umbilicus and the xiphoid process, and I'm going to start in between there and then go all the way down to the pubis. And then I'm also going to shave about 1 inch to 2 inches away from the mammary glands. So for this animal in particular, if this was maybe our incision, I would shave up to here to the pubis and then on the opposite sides of the mammary glands. So I'll give you a quick demonstration. I'm going to go with in the direction the hair is growing first to get the bulk of the fur off. Going to avoid the nipples as best as I can. And then once this is nice and short, I'm going to go in the opposite direction of the hair growth to make sure that I clip down and create a nice hairless surface for our incision. So now that I have got the patient clipped, in our hospital we vacuum and do a quick lint roll just to make sure that we get all of the hair off, and then I can go ahead and start my my general scrub. So I will put on my gloves here. After I wash my hands.
Do you want me to turn the camera?
Oh sure, thank you.
Ooh. Oh, there you are.
Washing my hands. Thanks, Kelsey. Okay, and now I'm just gonna put on some gloves here so I can start the scrub. I do not have water on my chlorhexidine just because I'm trying not to get the stuffy super soapy, but I would have water on the chlorhexidine as well as the rinse there. I'm gonna grab another glove. Oh, perfect. I brought a spare. It's like I knew that was gonna happen. Okay. So I will start with my general scrub. I have no true method to this. I'm just gonna try and remove as much dirt, debris as possible. Yeah, that might be nice, thank you.
There you are.
Thank you. So yeah, just removing the bulk of the debris there. Going around the nipples to make sure that they're nice and clean. We are prepping for a spay. So I've got the entire area that I have clipped, and that is now been generally scrubbed. So next I'm gonna start with my actual surgical scrub. I'm gonna go ahead and fold my chlorhexidine into a pointed tip. And I'm gonna start at the incision line, making small circles as I work my way around. And I'm not moving my hand in a different position. I am just rotating the scrub. And we've got all the way around. Next, I'm gonna go in with my rinse. And we're gonna do 5 of each, so sit tight. You're okay. And again, on a live patient, I'm maintaining contact the entire time. I'm not lifting my gauze. And another. And then this is the final Chlorhex scrub. Okay. And the final rinse. So now I'm just gonna step out of the camera here to grab my alcohol. And I've got this here. So I'm just gonna fold that up. And then I will go ahead and do okay, so now we've got our alcohol on, and I'm gonna grab my transfer drape.
Oh, wasn't just taking out your key. Do you want me to turn your camera again?
No, that's okay. I'm just gonna bring it right over. So I've got our drape, and I'm just going to pop it over, and we are ready for transfer. So I'm gonna go ahead and move us into our OR room. course, normally we move our patient onto the OR table, but it is being used right now. So when we move our patient, we always have someone at the top, someone at the bottom. We lift the back and then we just move over onto the table. So now I'm going to go ahead and discard the transfer drape here. And I'm going to start with my draping. We might just, we're not really a normal surface. Okay, that's gonna have to do for now. Hopefully you can see that. Okay, so now I'm gonna go ahead and start, now I'm gonna go ahead and get gowned and do my surgical scrub, and then I will be ready to do the draping. Okay, so I am now gowned and sterile. I am going to be starting with the drapes, the ground drapes, placing them over the patient, clamping the towels, and then I will move to the lap sheet. So I am going to be picking up my drapes. I don't know if you can see me, but I'll show you as soon as I get there. I am sterile here. I'm going to be picking up my drapes with my hands kind of on top of each other. There we go. And then I am going to lift and open. And then I will place this drape covering the head of the patient, but leaving some room at that surgical incision site. Next, I'm gonna go over, I'm just a bit worried because my patient is tipping over here, but we'll do our best. I'm gonna go over to the next one. And this will give you a better idea of how I'm holding, so like this. I'm gonna go ahead and drape that over. So again, this is where we'll make our incision. Now I'm gonna go and grab a towel clamp and I will clamp those two together. Go in with my next drape. This one is going to go on the bottom half here. And I'm just going to pull on that end there. And then we will put another clamp here and clamp those two together. I'm gonna go in with my final round drape. And I'm going to place that the same as the other. Making sure I don't touch the inner side. Okay, so now I'm going to make sure that I clamp the last two there. And then lastly, for my laparotomy sheet, or my fenestrated sheet, I'm going to pick it up. I'm going to place it similarly to the other ones, but this one I'd like to visualize where my incision or where the doctor's incision is going to be, and then try and get the hole over that incision there. And this is the wrong size for this patient, but this is just what we have, so I am going to come over, visualize, and place. So I can just move this over a tiny bit there, and we've got our incision, which I am based off of the line there on my patient. So yeah, that is me draping a patient.